Hello, my name is Shanda Blackmon, and I'm a thoracic surgeon at Mayo Clinic. And I've been asked to speak to you with this nice group about apps and social media and cardiothoracic surgery practice. We'll go around the table and introduce ourselves, and then we'll just have a nice conversation about how we think our practice relates to social media and apps, and how it can enhance your practice, and how we work with that on a day-to-day basis.
Thanks, Shanda. I'm Ed Bender. I'm a cardiothoracic surgeon in Cape Girardeau, Missouri, and I like to program software.
My name is Tom Varghese. I head the section of thoracic surgery at the University of Utah and got involved with social media for the last 3.5 years, and I'm honored to be part of this group this morning.
Thanks, Shanda. My name is Mathew Thomas. I'm a thoracic surgeon at the Mayo Clinic in Florida.
My name is Pieter Kappetein. I'm a cardiothoracic surgeon from Rotterdam, the Netherlands. Most important, I'm a Twitter friend of Shanda.
Excellent. So let's start with Ed. Talk to us a little bit about how you think the apps are enhancing our practice. I have a personal bias. I think in the future we'll relate to our patients through many of these apps and get feedback.
Well, I think you're right. I think that the great untapped area of mobile software or apps has to do with engaging our patients, in addition to engaging our colleagues and providing sort of a mobile knowledge base for everything we do every day. So I think that they are playing an important role. They'll play an even more important role as time goes on, and as I think doctors become comfortable with sharing more with their patients and families.
Right. And Tom, tell me a little bit about your Twitter account. You seem to be one of the busiest Twitter account people I know.
It's great. So I started getting involved with Twitter around 2012, and it goes in conjunction with, we had created a program called Strong for Surgery, which was about optimizing patients' health before elective surgery. And we were trying to figure out some mechanism of connecting with patients, and as a result, kind of stumbled along, sort of explored Facebook. But it seemed that there were an enormous number of patient advocates on Twitter. And one thing led to the other, participating in tweet chats, conversations, and I don't create a lot of my own content. I sort of call myself a curator because I just sort of go out there and find out those things that are interesting to me and then kind of share it with the world. And fortunately, the 7,000, I think as of this morning, 7,151 followers of mine kind of agree. And so I've learned a ton on Twitter, and obviously connected with a number of you nationwide as well.
Yeah, I remember waking up in the morning and watching my stepfather read 5 newspapers before going to work. And so I think our younger generation, like Matt, probably does the same thing. I now get up and I sometimes, when I have a little bit of a break, will get and look and see what Tom found interesting on Twitter. Instead of reading a newspaper, I'm now looking to see, I don't care so much what the financial market's doing. What I really care about is what are patients looking for? What are the new advances in lung cancer? And the best way for me to stay on top of some of those things outside of reading 20 journals is just to follow Tom.
I completely agree. I think, that there's a wealth of information there, and now we want somebody to, let's say, this is important, this is what you should read. And so instead of producing more and more journals, I think what the need is more for somebody that reviews it and says, this is important, and this is what you want to know, should know.
Yeah, no, and I think that Dr. Varghese, who's a pediatric GI doc in Houston, calls it the 4 C's. He says that on social media, there are 4 C's that people really think about. There are people who create original content, and they use Twitter or other social media vehicles to say, hey, I created this blog post, go ahead and read about it. There are others like myself who we call ourselves curators. There's phenomenal content out there, and all we're trying to do is just organize it in an easy, digestible manner so that other people can see what interesting conversations are out there. There are other people who use social media to connect. They say that it's the modern era mechanism of networking out there, trying to find who the interesting people are ahead of a meeting, look at the hashtag STS2016, and then see who's tweeting about that and say, I'm going to be in Phoenix this week. I'm going to use this as a mechanism to say, that's an interesting person. I'm going to go and introduce myself to them. And then I think that the last thing, which I think patients really are embracing, is collaboration. Patients collaborating with investigators, investigators collaborating with other things. This morning there's a great conversation going on saying that the historical mechanism of collecting trial data and sort of hoarding that trial data and preventing anybody else to have access to it is the wrong thing to do in this digital age. And so, I mean, these 4 Cs, I do believe are sort of the tipping point. And we're going to see novel uses. Maybe it's collaborating with apps or you name it. I mean, the sky's the limit, I think, for social media as well.
Do you also connect with individual patients?
I do, and so I'll give you an example. You know, LCSM, the hashtag LCSM stands for Lung Cancer Social Media. And so it was actually one of our thoracic surgery colleagues, Dave Cook at UC Davis, connected with patient advocates. There was Deanna, whose mother passed away from lung cancer in LA. But one of the patients who really embraced it was Janet Freeman Daly in Seattle. And so while I was in Seattle, I connected with her. I met her over a cup of coffee, and we started talking. And her story's incredible. You know, this is an individual who has stage 4 lung cancer, and she was one of the early patients who got the molecular targeted drugs. And she's now 7, 8 years out, and she's cancer-free. But she was describing this history about how when she first came out, everybody was telling her it was like a living wake. She said every single person that she interacted with acted as if she was dead already. And she's like, oh, I've got a great life to live. Yeah. And she's now going around the country and giving talks. And so that type of introduction or meeting would have never happened if I didn't stumble across a hashtag, and then I said, wow, this is an individual, and I said, oh wait, she's right here in Seattle. Yeah. And then I followed her and she followed me back, and then I direct messaged her, and then we set up that meeting. And so those type of connections, I think, happen, or you're able to meet people that you normally wouldn't have met because of this social media vehicle.
Perfect.
And Peter, you use it for EX, don't you?
Yeah.
To try to organize the meeting?
Exactly, yeah. We tweet messages, and we also tried to use it in sessions where people can ask questions to the moderators. And it's sometimes a little bit disappointing how many people use it. They're in an audience of 400 or 500 people. There are mostly 4 or 5 people that use it. So I think that will grow in the future. When people find out how you can use it, I think it will become more popular.
Yes, and I think it's particularly helpful for patients and young surgeons or young med students and residents who might want to have a career in cardiothoracic surgery. It's a great way to reach out to them. We still have not so many women in our practice, and so what we've done is the hashtag I look like a surgeon, and they've taken these pictures of these people who most people wouldn't think look like a surgeon, and it'll be this, mom holding her baby, and it's hashtag I look like a surgeon. So it's really kind of taken off, and that's just a good example of one of the ways that we've reached out to people in an unusual way to recruit more, and it does seem to be working. So Matt, how do you think that it's really helped your practice?
So I'm sort of relatively new to the social media in medicine. It's my 4th year in practice right now. So one of the inhibitions I had, or the hesitancies, the reasons I was hesitant in getting this because of the negative or the aspects that were associated with social media. You talk about, there's a book called You've Been Publicly Shamed, which I think is a great book to read for anybody who wants to get into this. It talks about people who have made a joke on Twitter or on Facebook and had their life destroyed. So reading, all the negative aspects of social media sort of made me hesitant in getting into this. But more recently, I've gotten into this because I find that it has helped me to sort of understand the landscape out there. We know it's a part of the landscape right now. It's an indelible part of the landscape of medicine, modern medicine. There's no way we can escape that. I see it in the 3 things that I use it for is what I call the P's, the PC, the PD, and the PH. That's the things I came up with. So PC is patient communication, PD is professional development, and PH is public health. So these are 3 arms of social media, or the 3 ways I think social media really helps me. I'm beginning to see that. Talk about hashtag LCSM. A couple of weeks ago, we had a good Twitter chat where patients were involved. Tom, I think you may have missed that, right?
Yeah, I was on the
It was
OR,
great.
unfortunately.
Yeah,
You missed your own Twitter chat?
It was great. It was the first time I was on Twitter chat, but it was based on these patient-oriented research. Patients coming up with ideas, but also had a number of docs in there, physicians, others associated with health, who brought up these questions. So Dave Cook would bring up a topic and say, okay, you know, pitch in.
Tell me what you
Tell
think.
me what you think, right?
Right.
So it's great because you have all these ideas that are coming in, and it was a good way for us to just, you know, banter back and forth and understand. And to me, it was a great way of saying, okay, well, here's my idea, and I put forth an idea, and before I knew it, after this was done, I got a tweet back from probably a patient saying, hey, there's a great way to do this. You know, go ahead with this idea. I'm going to connect you with somebody who's already doing something like this. And before I know it, you know, this networking has happened. I'm like, whoa, I never knew this was happening already there.
Right.
So, I mean, it has to me opened up a whole new world of how I can practice medicine. I think it's going to be different. It's exciting. So
you can also use it for to send reminders to patients, isn't it? So for secondary prevention, you know, and help people stop smoking, for example, or take the medication or exercise. And it's also a way that they send messages to patients and to remind them on certain aspects.
And I think, Dr. Bender, you've worked on that quite a bit, building apps that intervene for people in a timely manner.
Yeah, I've developed some apps mostly for use by folks like us, but tried to translate that into more layperson language so that they can use them. But I'm really intrigued with the kind of inertia that you described, getting over that fear of interacting and then having that whole world of social media open up to you between the physician and the patient. And you know, I must admit, I frankly don't think about that too much. It may be the type of practice I have or the geography I live in, but I think it's something that I personally need to explore, and I think it would be good for the patients. But I still don't want to ignore the collegial interaction among social media. The Thoracic Surgery Social Media Network, hashtag TSSMN, is becoming more and more involved in sharing scholarly information, and I'm really happy to see that the publishers and the societies have taken this up as a cause also. We'll be bringing full-text articles available for participants in the TSSMN hashtag, and I think that's really important.
And Mara Antonoff has done a great job of leading that. It's looking at all the publications coming out of the Annals of Thoracic Surgery as well as the JTCVS. So it's a joint venture and allows you to look at the landscape of what's coming out in 2 major journals.
What I'd kind of like to do is to be able to translate that into involvement for patients and families. Let's say that there's an interesting article about the treatment of esophageal cancer, for instance. Open that discussion up to the patients and families, have sort of a more understandable nomenclature so that everybody can participate. We don't want to hide behind the jargon, even though the jargon is shorthand for us and we use it. I think engaging patients in these sorts of discussions, engaging them in the scholarly discussion that adds a personal touch to it for the patients and their families, I think is going to be an important part of this.
Right, and I know Joe Duraney has developed a few Facebook pages that look for patients with hypoplastic left heart syndrome or patients with Epstein's anomaly, and he was telling me these wonderful stories of getting into touch with patients. As we were driving to the airport, he got these calls, and the calls came from this Facebook page or from this blog that he had started to reach out to these patients with children with unusual congenital heart defects. So it is a great way to reach out to patients and educate them with the material that we think is important, not what an advertising firm thinks is important or what industry might feel is important.
Yeah. So if I may ask, you also had this idea of the wealth of information that we were talking about. You know, journals produce a lot of articles. And I think you had an idea of how to make it more accessible for surgeons and another way of subscribing to journals.
I think that there is a lot of knowledge out there that's untapped. I'm a little bit biased because I come from a non-academic center, and I think that after 20 or 30 years of practice, non-academicians have a lot to share. So I think that a platform where those folks can be incented to share their past experiences, these aren't randomized trials by any means, but they're just past experiences, I think would be very valuable to the community of of doctors and surgeons and even patients throughout the globe. I think that it's an untapped resource, and I'm sure there's a way to involve those types of folks like myself to share that through either formal applications or social media, but we need to explore that further, I think.
Right.
So there's another advantage, Matthew, when you get out into practice, you're by yourself down there in Florida. If you need some advice, you can get on Twitter and you can have a Twitter mentor to help you through run through difficult cases.
Exactly. So I think that's a great idea. The question then becomes patient privacy, obviously. You know, you're putting it out there. Remember, to me, Twitter is like you're standing at the corner of a street and saying something out loud, and anybody who travels through can get to it.
That's a fantastic point. I mean, there are organizations like where Shanda's at the Mayo Clinic who've really embraced social media, but they've actually put rules in place for exactly that type of thing.
Right.
I mean, Dr. Tamimi, who leads the social media movement over at the Mayo Clinic, I mean, really comes to mind. And you hit it right on the head. I mean, we want to get information out there. We want to be able to engage it, but it is the public domain.
Yes.
And so I do think that we have to be careful that, you know, we don't unknowingly breach, you know, patients' confidentiality
Right.
during these discussions. And that's a fantastic point.
Yeah, and I think otherwise, if there's some way for us to communicate or discuss things in sort of a secure lane, I think it'd be great. Or
On the other hand, though, you know, physicians historically have always been public figures. I mean, you know, we present at M&M, you know, we talk things over at conferences. And so I do think that, yes, we have to be careful, but I also think that physicians are the perfect individuals to lead these conversations. So they're kind of used to that already.
We practice every day.
We practice every single day. Yeah, we always have conversations out there. And we do it in a respectful manner, and we make sure, you know, I'm taking care of a patient with X right now. I mean, there's no breach of confidentiality when you kind of describe it that way, and you seek other people's opinions. Now, the beauty of this now is you're not confined now geographically to the walls of where you're currently residing, and so that, you know, Ed and I can have a conversation, and we've had lots of conversations online, but, you know, we get the opportunity to hang out with each other at meetings, but, you know, that is only once in a while. I mean, we're able to continue that conversation, you know, well beyond that as well. And of course, with Pieter, you know, we can say, great, I could reach across the pond and everything and have the conversation. Within minutes. Yeah,
Right.
talking about, sometimes it feels like you're on that Big Brother show, you know, where everybody's watching. Right now, there's a conversation going on about SBRT versus lung resection.
Correct.
If you followed that conversation, it's kind of interesting because patients are also listening. There's banter going on between two different specialties. So we want to keep it collegial, professional, and have the understanding when we say anything, obviously, that others are watching it. Because I feel like every time I say something, I'm sort of creating an image of what I look like to the public, in the public
You
sphere.
are
right?
curating an image for your patient.
So it's very hard, you know, for me to change that later on once I've said something. So I have to be careful. I have to be really choosy in what I say and how I say it. Because I might mean something, but I might say it in a different
So
way.
I think this is the perfect panel. We have the one who's very excited and the one who's very cautious. It's a perfect balance. And that's a great way to wrap it up. So thank you, everyone, for joining us for this wonderful conversation. I hope that you consider engaging in social media and building apps to benefit your patients and all of your colleagues. It's a great way to reach out. It's the way of the future. And if you're not on board, you should be. Thank you.